did want someone to talk about the MLE, but because one of our batchmates has already matched and started her course. Alan Joe is currently in the US doing an observership, and he found time to be able to record a video with a list of questions that I had asked. Now, so we'll be playing the video, but if I'd like to ask you guys to keep your questions to the end, so that once we're done with the video, you can ask us. Yeah. Sorry, that's not Alan.
Hey everyone, my name is Alan, and I'm from batch of 2011. And Dr. Kevin, my classmate at this.
Can you hear that? Yeah. It's clear.
Called me a few days ago, and he was telling me about how he and a few other guys were planning to give a small talk to the juniors and trying to get them up to date about the various postgraduate training options that are available to them both in India as well as abroad. And I'm glad that he was able to put this together, because I'm sure that it's going to be very informative and very useful to you guys when you move through the years of medical college and eventually want to get into postgraduate training. So that being said, I wish I was there in person at St. John's to do this talk, because unfortunately I wasn't in town and I had to do a small video recording and try to cover as much as I can about the United States medical licensing exam. So I just took those exams recently, so I thought I could tell you guys as much as I can about what the exams are all about, the whole outline to a US residency. So Dr. Kevin gave me a bunch of questions to answer, and 20 minutes is a short time to cover the entire topic of the whole exam and the path to residency and the costs involved and all of that. But I'll try to put as much as I can in the limited time that I have, but I'm sure that there are so many resources both online and offline which you guys can go back and read up on and get more information and keep yourselves updated as to what's going on with the various entrance examinations that are happening now. So that being said, let me just cut to the chase and start talking about what the United States medical licensing is all about. Examination is all about, rather. So the examination is divided into three major parts. So you have your step 1, step 2, and step 3. Step 2, let me just tell you, is subdivided into step 2 CK, which is your step 2 clinical knowledge, and step 2 CS, which is your step 2 clinical skills. Now what is tested on these exams? Step 1 contains primarily your preclinical subjects, which is your first year and second year subjects, and step 2 CK, which is also an online multiple choice question exam, has you being tested on the third year and final year of medical school. And what is step 2 CS then? Step 2 CS is your step 2 clinical skills, and it is primarily something very similar to your medicine or pediatric practical exams. And step 3 is a mix of both step 1 and step 2, which primarily contains management questions, and step 3 can be spoken about later. You guys can read up about it because it's not as important as the rest of the steps. So that being said, what does completing step 1, step 2, and step 2 CS give you? It just licenses you as a physician in the United States, as the entire name of the examination stands, which is the United States Medical Licensing Exam. But once you get licensed in the United States, does that mean you can practice in the United States? The answer to that is no, you can't, because you need to have completed a residency in the United States for you to be eligible to practice in the United States. So just clearing the exam does not allow you to practice. So essentially what the United States Medical Licensing Exam is all about is just a pathway for you to get into residency in the United States and nothing more. So that being said, what is the application process? The application process is online. So if you just go online and type in United States Medical Licensing Exam, I'm sure all of that will pop up. And you guys should be very grateful, because if any of you do plan to apply to take the exam, the student section just knows everything that they should be doing for you guys, so that you can send in your applications on time and eventually get your permit for the exam. So, what is the pattern of the exam? So the exams are all online multiple choice questions. So let's start with step one, which is the most important exam. Yeah, I told you, I started off by telling you that it is divided into preclinical subjects and, step two is more of clinical subjects. But let me just tell you that step one is the most important exam you will be taking if you were to apply to a United States residency. So what is the exam all about? The exam, as I said, is filled with preclinical subjects, and it is an 8-hour exam. So I know it streams that it is an 8-hour exam. It has about 280 to 320 questions divided into 8 blocks, and each block is about 40 questions, and you have 1 hour to answer each of those blocks. So step 2 CK is again a very similar exam, but it's just a little longer. It's about 9 hours, and you will have to answer about 300 to 320 questions, which is divided into 40 question blocks and split out over 9 hours. And step 2 CS is a practical exam, which you can take only in the United States in specified centers. So you will have to fly down to the United States to do the step 2 CS, which is a practical exam, and you have 12 cases, which are standardized cases. So basically you have patients who act out clinical case scenarios, and you're expected to interact in English, take a good history, do a quick physical exam, and come out of the room and put in a patient note on a computer, because most of it in the United States is all digitalized, and we expect you to have fairly decent typing skills to put in. Fairly decent typing as well as good grammar to put in a note which other people can understand. So that is the gist of the entire exam pattern and duration, and what the exam content is going to be when you write it. I'm sure if you guys are more interested into what the nitty-gritties of each of these exams are and what the actual content of these exams are, you can always go up to the USMLE website and look it up. Because if I could get into that, there's just way too much information, and I don't have. There are many other things which is probably more important than getting into that right now. Now, Dr. Kevin asked me to speak a little bit more about the preparation strategy, and that is something which I personally believe is to each his own. Now, there are classes which are going around in Bangalore, I'm sure, because I've heard of Kaplan coming into Bangalore and a bunch of other, what do you call them, entrance classes which are going around in Bangalore for USMLE. But then again, it's up to you. If you prefer to do them on your own, it's very much possible, because in the recent past I've not heard of anyone who actually gone for classes and written this exam, because most of the material is available online and most of the resources are available quite easily. So I'm sure it's being circulated in St. John's and you can get hold of it. Of course, there are a few resources which you have to pay for, but they're absolutely worth it. And I'm sure that you have to grab hold of those resources and try to figure out what best works for you. So there are, like for me, there are 100 question banks and 100 books as materials and resources, but it's up to you to see what works best for you and pick them up. And if there's one thing I can tell you, which is the key, whether irrespective of if you're going to go to a class and learn or you're going to stay at home and self-study, the key to cracking these entrance exams is revision. You cannot just sit and read and try to cram as much information as you can and not, try to see if you remember it. So you will have to revise stuff and do as many questions as you can, because the more questions you do, the better you retain things, and the better that makes you much better prepared to go and give in a competitive exam. So switching from writing subjective answers in your university exams to answering multiple choice questions is quite the jump, and before you give any competitive exam for that matter, you guys have to prep to answer multiple choice questions, because cracking multiple choice questions is a different ball game compared to what your subjective answers that you guys write in the university exam. So the next thing which people ask is, how expensive is the whole process? Honestly, I can't give you an answer to that, because there are some things which are fixed, like examination fee, and there are some other things which are flexible, which include your flight tickets, your stay in the United States, your internships and your clerkships and your observerships and all of that. So all of that is flexible, and it all really depends from person to person. But however, I can tell you that the exam fee is about $1,100 for step 1 and step 2 CK, and it's about $1,600 for step 2 CS. So overall, you'll be spending about $3,800 just for your examinations. And I'm sure you guys will figure out what the other expenses are based on what you guys end up doing and where you guys end up going for your observerships and clerkships and all of that. Now, what can you do in medical school which can not necessarily fast track you, but put you in a good spot when you guys are applying to residency? So what does a program director look for when you apply to residency? First and foremost is your step scores. So as I mentioned, you guys have to work hard and get a studying approach sorted before you start planning to give these exams. So you need to have a schedule and make sure that you have the right material which is best suited for you, and make sure that you revise and are well prepared before you give that exam so that you get a good score. So step 1 and step 2 are the most important when it comes to scores, and step 1 more than step 2, of course, and those are the things which program directors look at first. Now, apart from the scores, what do program directors look at? US clinical experience. Now, what is the US clinical experience? US clinical experience is something which you do in the United States as a student. So now there are two kinds. One is a clerkship and the other one is an observership. Now, what is a clerkship? Clerkship is something you do when you are a student, and an observership is something which you do after you graduate. So the one which college has with University of Minnesota is a clerkship, and that, if you do get through with that, that is a great opportunity to be in the United States clinical system and try to understand how things work, because essentially you are working like an American medical student. So you get to see patients, you have patient contact, you get to take histories, do physical exams, present them on rounds, and put in notes. And eventually your preceptor or your professor who you work with gets to assess you based on your performance in those clerkships and write you letters of recommendation. And letters of recommendation do play an integral part of your application, which I will come to after I finish this. So that is your clerkship. Clerkship is something you do before you graduate, and the University of Minnesota program is one of those things which are considered as a clerkship. And there are other ways to get clerkships if you're not able to get through with University of Minnesota, but you guys have to go and look it up, because if I delve into those details, it's going to be a whole other deviation from this talk. So what is an observership? An observership is something which you do after you graduate, and it is just minimal patient contact. However, you are exposed to the United States medical licensing, you're exposed to the US clinical setting, and you just get to shadow a professor, and you just follow them and see the way they interact with patients, the way they put in notes, rather than you doing it yourself. So is an observership as good as an elective or a clerkship? It's possibly not, because obviously they're two different things. But if you don't have the opportunity to get a clerkship, is an observership better than nothing? Of course it is. So observership, just because you don't get to talk to patients and put in notes and all of that, it doesn't mean you can't do anything else. So you can present topics and participate in conferences, give your opinion about case discussions and all of that, so that you're actively involved, and eventually the person you work with or shadow with can write you a good letter of recommendation. Now, what are these letters of recommendation? So when you apply to United States medical licensing, I don't know why I keep saying that, but when you're applying to a residency in the US, you need to have at least 3 letters of recommendation. And a letter of recommendation is basically a letter from a physician who you worked with, telling the program director to the programs you applied that this student was with me and he did well on the rotation, and he's well accustomed to the United States clinical system, and he's all set to be a part of your residency program. So that is what the basic content of a letter of recommendation. And you can get these only by working under physicians in the United States, either through clerkships or observerships. So those are the two broad options you have, to build your US clinical experience. Now, moving on to research. Since I am applying this year, I don't know as to what the weightage of research is when you compare it relatively to the other things which I mentioned, such as your step scores and your clinical experience. That being said, research is something they look at, and if you do have good papers and good publications or good case reports, it is definitely something which would be a plus point to your application, and definitely it is something you can talk about when you do interview for residency. So I'm not going to go too much into research because I'm sure you guys have people talking to you guys about research and all of that, and eventually if you guys are interested, you can pull out a few papers during undergrad. But I would say that research is an integral part of your application, but it is not the be-all and end-all of your residency applications, because there are a ton of people who do match into programs without research. But that being said, it's good to be exposed to research, because in the United States you can't really get away with just doing clinical medicine, because research is an integral part of their system, and being exposed to research early in undergrad is very useful. So moving on to the next bunch of questions which Dr. Kevin has put out is what else can be important to help with your application if you're applying to residency in the US. Extracurricular activities do play a role, so if you guys are involved in culturals and sports and all that, of course you're going to add it to your CV, but it's definitely not as important as the rest of the things I mentioned. So that's just another pointer. So if you guys are active in culturals and sports and all of that, you can just put it in your CV and basically have something to talk about when you're interviewing. So now that I've spoken about what the steps are, the cost involved, and briefly about what the preparation strategy would be, which again is not something I can really emphasize on because it depends from person to person as to how you go about it, and I'm sure there are more resources available online which can explain that in detail. And so what is the entire path to US residency? So I've given my steps, I've passed it, I've got fairly decent scores, I've done 2 months of clerkship in Minnesota, and now I'm here and I want to apply to residency. So what do? So I finished my application, I've written in my personal statement and all of that. So now I want to apply to an internal medicine residency in the US. So what do? So my application is complete, I have my step scores, I have my letters from the people I worked with and all of that. So when you're applying to residency in the United States, it's pretty much something like what the NEET system is. So you have an online portal where you upload all of your documents with your step scores, your letters, your personal statement and all of that in the month starting June through September every year. So you put in your stuff, and September onwards, the programs you apply to for the specialty you're applying to start sending you emails saying that, look, we are interested in interviewing you for a spot in our program. So on an average, people with great scores get about 10 to 14 interviews every interview season, and interview season starts from October and goes on through January. So you have to be in the United States during those months and go to all of the programs that decide to call you for an interview. And then once you finish interviewing, you've got to rank the programs in order of your choice. So if I interview at 5 places, it's namely 1, 2, 3, 4, 5, and I like place 3 more than place 1, I would rank place 3 above place 1, and so on and so forth. And the programs themselves will also rank their candidates, and come March every year, you will know if you've matched into a program or not based on an algorithm which is complicated, but they do it, and based on your ranking of programs and their ranking of candidates, you eventually come to a match which is called the residency match, and it happens the second week of March every year. So that is basically a very, very brief outline as to how the entire match process happens. Of course, it's not as easy as I make it sound. It is quite complex, and a lot of effort and work does go into the entire process, but I'm just here to give you a small idea as to what the entire process is, and you guys can always go up and you get a detailed version of the entire process. So that being said, as medical college students, what can you guys do to prepare yourselves to take these exams? I highly recommend that you guys study on a regular basis and learn the concepts that you guys are taught right from first year to final year, and try to understand topics, because eventually the basics which you think are pretty pointless are the ones you're going to be tested on when you write your steps, and it's definitely going to help you in the future as well when you're practicing medicine. So be attentive in clinics and try to learn as much as you can when you're studying for those exams rather than just trying to pass exams. And the more you grasp the topics, the better it is when you write these competitive exams, because it's all deriving things off concepts rather than you trying to mug 100 things and just vomiting it out on a theory paper. And pay attention in clinics, because you have wonderful teachers who tell you everything you need to know for clinics, and most of those questions do come up from clinics. I for one can say that there were so many questions on my step to CK which I could recall saying that, oh, this doctor taught me this when I was in clinic in college. So that's definitely something you can work on and start preparing in advance. Decide on what you want to do. Look up all the other options. I'm sure people have spoken to you about all the other entrance options as well, and try to research on them and try to see what works best for you. And once you decide on something, make sure that you get the material that you need and start preparing as early as possible. It's never too late. So start studying and trying to understand the basics better, start improving on your concepts, start doing questions, even if it's just 5 questions a day. Something is better than nothing, so that you guys can get into a groove of studying, and revise as much as you can, because revision is key when you're writing these multiple choice tests. What can you do for USMLE apart from getting hold of all these resources is definitely the University of Minnesota St. John's clerkship program is unbelievably good. So if you do get a chance to get selected, I highly recommend that you go ahead and go for it, because it is a wonderful experience, and it really tells you what the entire system is like, and you guys can decide if you want to do it or if you don't, and decide on that once you have been exposed to the system. And that is not the be all and end all. So the people who don't get selected, there are many options to look up online when it comes to clerkship. Many programs do offer clerkships in the United States for international students, so you guys can look that up and try to get a couple of rotations in as well, so that you have an exposure to the system, and then you can decide to go ahead with your steps and eventually apply for residency in the United States. Research-wise, I highly recommend that you learn as much as you can when it comes to research, get yourselves exposed to methodologies of research, writing up case reports and all of that, and I'm sure nothing of that will go to waste, because whether you do it in India or the UK or the US, if you have good research experience, it's definitely going to help you when you become an assistant professor, associate professor, or a professor, because research is the way medicine is progressing, and you need to be oriented to that. All I would say is good luck to you guys, and I'm sure I'll just leave my email ID with Kevin, and if you guys have any questions, I'd be happy to answer it, and you guys can just shoot me an email, and I'll try to get back to you guys and try to help you as much as I can. And I'm applying to this year's match as well, so I can let you guys know more in detail about what the entire match process was like, for sure, when I come back to St. John sometime, and when a similar talk is organized, I can talk more about what the entire process was and speak more about detail and eventually answer your questions as well if you guys have any. Okay, and good luck to you guys, and hopefully I'll see you guys sometime in St. John's, and then we can discuss more about these things. And hope you guys enjoy yourselves through medical college, because those are definitely the best days of your life. So make the best of it, and also plan your future so that you eventually decide to eventually do your post-graduation of your choice in the place of your choice. So plan ahead, and good luck to all of you guys. And thank you to Kevin for having me speak about this, and I'll see you guys soon. Take care.
So obviously for that session, you're going to have to keep your doubts with you till the end, and we will be putting up all of our contacts and email IDs. We'll also be putting up this PowerPoint on Drive, which we'll be sharing with you guys. So if you want to get back to any of the facts that either Andy, Alan, or any one of the rest of us that talk put up, then you can go back to it and check it, basically. Okay. There were a few things that, how many of you know about the Minnesota exchange program that happens at St. John's? Okay, so can you raise your hand slightly higher? Yeah, cool. Okay, so basically that's a program that allows a select number of students from St. John's to go to the University of Minnesota and their affiliated hospital, and be there for a clerkship for between 4 to 8 weeks. So there is a selection process which begins in the early part of your internship, and you have an interview, and then based on that you're selected. So two things that are really important for that are your marks and research work, if any. So again, that's another reason to do well at exams and to try and get some research under your belt. Alan also mentioned the personal statement. So the personal statement is basically, I think, about 500 to 800 word write-up about why you want to choose the particular postgraduate stream that you want to do, and what is your mission going forward, and so forth. There was a specific question about cost. So just for the exam fees, as Alan mentioned, it's around about $3,000, including, so obviously additional would be your flight fare, accommodation, and so according to Alan's estimate, and this is just a rough number, but for exams plus 2 months of rotations in the US, the cost would be about $7,000 US. So make the conversion, and that would be it.